Take a look at this image. What do you see? For some people, it looks like scattered black and white patches. For others, the dog appears almost immediately. Can you see it? Once you see it, something interesting happens. You can't really go back. You've seen the pattern. Next time, your brain picks it up much faster. I'm Dr. Sanil Rege, consultant psychiatrist and educator, and I've trained thousands of clinicians in brain-body neuroscience and psychiatric practice. In this video, I want to use this simple illusion to explain something important about ADHD. ADHD is not just about attention. It's about how the brain detects significance in a world full of competing signals. And once you understand that, treatment starts to make much more sense. You see, the brain is not just passively receiving the world like a camera. It is actively trying to make sense of the world for you. It predicts. It compares. It matches prediction with outcome. It checks whether what is coming in matches with something it already knows. So when you look at this image, your brain is asking, what is this? Does this mean anything? Have I seen this pattern before? At first, there may be no match, just noise. But if you stay with it long enough, the pattern emerges. The Dalmatian appears. And once that happens, the image is no longer random. Your brain has formed a pattern. It now has a template. So the next time you see it, recognition is quicker, easier, more automatic. That is the key idea. The brain evolved for pattern recognition. Because in many ways, treatment in ADHD is trying to help the brain do exactly that. See the pattern more clearly, stay with it for longer, and return to it more reliably. But what ADHD does is it creates a lot of noise, lots of dots, difficult to discern the image. It also makes persistence hard. Let me explain this in a bit more detail. Think about what is required to see the Dalmatian in this image. You have to stay with the image. You have to tolerate a few moments where nothing obvious is coming together. You have to remain engaged long enough for the brain to organize the noise into meaning. This is where ADHD becomes relevant, because in ADHD, other stimuli often compete too effectively. A sound, a thought, a feeling, a memory, a notification, a slightly more interesting possibility, a small frustration, a drop in reward, boredom, and as a result, the system shifts. We interpret that as the person can't pay attention, but the difficulty is that the task may not hold enough significance long enough against everything else that is competing with it. This is why task persistence becomes so important. It's also why people with ADHD can focus extremely well in some situations and very poorly in others. The issue is not the total absence of attention. The issue is what gets tagged as important enough to hold attention in place. The reason why I like this illusion is that it captures something patients often describe. Before the pattern's clear, effort feels hard. It feels unrewarding. It can feel almost impossible to stay with the task. This is what patients describe as, I'm bored. But once the pattern is seen, everything changes. Now the brain says, I know what this is. I've seen this before. This makes sense. And it's this shift that we're trying to achieve in treatment, because ADHD treatment is often about helping the person build those patterns more reliably. In daily life, patterns around getting started, patterns around changes and transitions, patterns around procrastination. This is why good treatment is not just about symptom reduction. It's about helping the person recognize how their brain works. So let's come to medication, specifically stimulants. And I'll explain what stimulants actually do. The common way stimulants are explained is that stimulants will improve attention. Now that's not completely wrong, but I don't think it's the most useful way to understand how stimulants work, what they do, and what we're using them for. A better way to think about stimulants is that they often increase the significance of the task. They increase what's known as task salience. Salience is what grabs the brain's attention. Stimulants also increase reward relevance. Reward doesn't mean pleasure. It simply means the ability to stay with the task, to match prediction and outcome. In other words, to make sense of what we're engaging in. Stimulants also increase arousal. And through this combination, they can improve task persistence. The key is that they do not automatically decode the world for you. They do not magically reveal the Dalmatian. They do not magically create meaning out of nowhere. But they may help the brain stay engaged with the image or the task for long enough so that the pattern can emerge. That's a very different model. And in clinical practice, I think it's much closer to what we actually see. So rather than saying stimulants simply improve attention, it may be more accurate to say they help the brain hold on to the signal long enough for useful patterns to form. But there's a catch. And this is where treatment needs nuance. If stimulants increase the significance of stimuli, they do not do that only for the right things. They increase significance more globally. So what becomes more important after treatment depends on the person. And not everything that becomes more significant will be adaptive across the board. For example, for some individuals, past shame or social threats or anxiety, perfectionism and high standards, a phone, gaming, conflict, fear of failure, the need to stay busy. There are so many stimuli that can magnify here. This is why prescribing is not just about increasing activation. It's about understanding the person. What has mattered for this person in the past? What is dominating the system now? What needs to become more significant in the future? This is where formulation matters. Because medication may strengthen the signal, but we still need to know which signal is going to be strengthened. So if we bring all of this together, what are the key aims of treatment? Number one, provide or develop a coherent model. What I mean by this is that help the person see the pattern in their life. For many people, diagnosis is powerful because it's the first time the noise begins to organize into something understandable. I understand why I've been the way I've been. It's the first time the Dalmatian becomes visible. But simply seeing the Dalmatian in this scattered image doesn't mean that the individual can see the patterns in other images. So that takes us to number two, improve the signal-to-noise ratio. We try to make the relevant signal stand out more clearly. That may involve medication, but it also involves sleep, structure, environmental changes, reducing interruption, treating anxiety, and changing how tasks are approached. It's important that we take a broader lens here. Number three, train pattern recognition. If the brain's a predictive organ and has evolved for pattern recognition, the clinician's role is to help the person recognize repeated sequences. The same applies for partners or parents or teachers. We've got to ask, what helps individuals stay on task? What does under-arousal feel like? What does over-arousal feel like? What are the competing stimuli? What contexts make their brain work better? Essentially, we translate the improvement in the signal to their functioning. And number four, offer a predictable relationship. The brain learns through repetition, and it requires predictability. I've covered this in the video here. The brain didn't evolve to make you happy. It evolved to help predict your world. So a consistent, reliable, therapeutic relationship helps the person repeatedly see the same pattern from a safer distance. So creating repeated, reliable experience is how the brain starts to trust a new pattern. And this takes time. Now you'll notice here that what I've talked about matters even more in children. Why? Because children are still learning how to organize their internal world. They often cannot yet identify the patterns for themselves. They need help from caregivers, teachers, and clinicians. They need someone to say, this is the moment you got distracted. This is what frustration looks like in your body. I can see that you were upset when you were asked to do that task. In other words, children often need another mind or person to help make the pattern visible. This is a really crucial part of treatment because it's not just medication, it's also helping the child repeatedly experience structure, predictability, and recognition until those patterns consolidate. So let me summarize this for you. ADHD is not simply a disorder of not paying attention. It is a disorder in which the brain does not always reliably assign significance to the right thing at the right time in a stable enough way to support persistence. That's why novelty works, urgency works, interest, emotion, deadlines work. Sometimes people need panic to move. These states force significance. So when a task is important without being immediately stimulating, the system just doesn't activate. And that's where people start blaming themselves, or others call them lazy, undisciplined, inconsistent, unreliable. But the key issue here is that the brain has not tagged the task as important enough, long enough to remain with it. So I hope this has given you a different way of seeing ADHD. And I think it's a lot more useful than simply thinking of it as an attention deficit. So if there's one thing to remember from this video, remember this. When you look at the Dalmatian illusion, note the image did not change. What changed was your brain's ability to recognize the pattern. And that is very close to what we are trying to do in ADHD treatment. Help the person detect the right signals. Help them remain with those signals long enough for the pattern to emerge. And then help adaptive patterns become easier to access, easier to repeat, and easier to trust over the long term. I'm Dr. Sanil Rege, and you're watching the Dr. Rege channel. If you like this video, hit the like button and let me know in the comment section how you conceptualize ADHD and its treatment. I look forward to seeing you in the next video. Until then, stay curious. Bye-bye.